Welcome to the Transforming Trauma Podcast, a complex trauma podcast through the NARM Training Institute. My name is Sarah Buino, and I'm so excited to be sharing today's interview with you. Hey, Transforming Trauma listeners, please join us starting in November for our online NARM Basics training to learn how to transform trauma. This online NARM Basics training is available for professionals working with clients or populations dealing with complex trauma. Now more than ever before, it is essential that we learn how to resolve complex trauma and support post-traumatic growth. NARM provides a relational approach to addressing the current COVID pandemic and tools to support healing in the aftermath of this collective trauma. If you're looking for more advanced training in complex trauma and are working in mental health, healthcare, education, substance abuse recovery, or allied fields, join us for this Level 1 NARM training to become a NARM-informed professional. For more information and to apply, please visit www.narmtraining.com/online-basics. Today's guest on Transforming Trauma truly needs no introduction, but I'm going to go ahead and introduce him to you anyway. Richard, or Dick Schwartz, began his career as a family therapist and an academic at the University of Illinois at Chicago. There, he discovered that family therapy alone did not achieve full symptom relief, and in asking patients why, he learned that they were plagued by what they called parts. These patients became his teachers, as they described how their parts formed networks of interrelationship that resembled the families he had been working with. He also found that as they focused on and thereby separated from their parts, they would shift into a state characterized by qualities like curiosity, calm, confidence, and compassion. He called that inner essence the self, and was amazed to find it even in severely diagnosed and traumatized patients. From these explorations of the internal family systems, or IFS model, was born in the early 1980s. IFS is now evidence-based and has become widely used in psychotherapy, particularly with trauma. It provides a non-pathologizing, optimistic, and empowering perspective, and a practical and effective set of techniques for working with individuals, couples, families, and more recently, corporations and classrooms. In 2013, Schwartz left Chicago and now lives in Brookline, Massachusetts, where he is on the faculty of the Department of Psychiatry at Harvard Medical School. So I think you're really going to enjoy hearing Larry and Dick talk about their experiences and the way that they use these different models to help people transform trauma. So please enjoy this conversation between myself, Dick Schwartz, and Larry Heller. Hello, we have Dick Schwartz and Larry Heller with us on Transforming Trauma today, and I'm just so excited to witness the conversation between the two of you and to get to be a part of it. Welcome.
Thank you, Sarah. It's nice to be here.
Thank you, Sarah.
Yeah. So normally we start the podcast by asking what the interviewee would like listeners to get out of the podcast, but I want to do this one just a little bit differently today because we found that NARM and IFS get compared a lot. And so essentially what we really want to know is we want to hear more about the model from you directly and have you and Larry talk about the similarities and differences. So that is our podcast hope for the listeners today.
Okay, sounds good.
That sounds good.
Yeah. So I wanted to start off more about essentially being very timely in what's going on in the world right now. And we are obviously, we've said unprecedented enough, I think, but we are at just a really interesting time in history. And I'm curious, Dick, I'll start with you from an IFS perspective. Is there anything that you really want to share with listeners as it relates to the pandemic, systemic racism, and collective trauma that we're all in the midst of right now?
I guess what I'd say is, for me, this is a kind of global wake-up call, both in terms of environmental stuff. It's sort of like the planet is finally saying enough and forcing us to slow down and really look at what we're doing to it. And then the Trump administration pulled back the curtain a lot on how much racism there is in the US in a way that nice liberals like me could deny before. And then the murders on TV really ripped the curtain back. So it's in everybody's face. And for me, it's a good thing because it exposes what we call this cultural legacy burden of racism that permeates and that enters people. And most everybody in this country has some, as much as we want to pretend we don't. So that's what I'd say about it.
Yeah. Thank you so much. Larry, I know that you and Brad had done a webinar, but this will be the first time the podcast listeners get to hear your thoughts on these topics.
Well, I certainly find myself agreeing with Dick in terms of the overall dynamic. And the other piece that, that I did talk about when I was with Brad is it's also an opportunity for us to look at ourselves, not just the institutionalized and systemic kinds of issues which are, of course, extremely important, but also in terms of our own reactions to the very real threat that both racism and COVID present, and then what that touches in us, and also a time for our own personal work to look at those dynamics internally. So that's, in short, kind of the opportunity that I see here.
Yeah. Thank you for both of you for addressing that. So to dig into really IFS. So for folks who might not know what that is, IFS is internal family systems, and Dick Schwartz here is the father of that, so to speak. And it's a complex model, so I'm sure there's not really just a sound bite, but if you could just describe it a little bit for listeners.
Okay, I'll do my best to keep it short. So the basic idea is that everybody is a multiple personality in the sense that we all have what I call parts of us that other systems call other things. And the natural state of the mind is to have these parts. So we're born multiple, and that's a good thing because each of them has qualities and resources to help us in our life. And so there aren't any bad ones. I'm sort of the Will Rogers of the phenomena. I've never met a part that ultimately I didn't like. And I've worked with parts that have done heinous things. But as you get to know them, you learn that they aren't what they seem at all. And that, in fact, it's the nature of the mind. We're born this way. And then as these very valuable parts encounter trauma in our lives or attachment injury, they're forced out of their naturally valuable states into roles that can be damaging, that often were necessary to save us younger times when we were experiencing the trauma, but are anachronistic when we're adults, and still these parts feel like they have to keep doing it. So between traumas and attachment injuries, these parts also take in what we're going to call burdens, which are extreme beliefs and emotions that come into us during those experiences and attach to these parts, almost like a virus, which is a popular word these days, almost like the coronavirus, then drive the way the part operates thereafter. And so one of my big crusades is to help psychotherapy and the culture realize that parts are not the burdens they carry, because often they're mixed up that way. And so we go to war against the burden, not knowing we're actually fighting against the part that's stuck with the burden and can unburden. And when it unburdens, it'll transform into its naturally valuable state. So that's parts. And then as I was experimenting with all that almost 40 years ago, and coming from a family therapy background, I was spending a lot of time getting one part to separate while two others were talking. And as I got parts to open space inside, it was like this other person popped out who knew how to relate to these parts in a healing way. And blew my mind because I was working with people who had horrible backgrounds. And if you trusted basic developmental psych, shouldn't have anything like that inside of them. But here it was. You get a few parts to open space, and suddenly this new, seemed like a part took over, and I would get out of the way because they knew how to start to heal themselves. And when I asked, now what part of you is that? As I did it with many other people, and it was like the same part would pop out, same qualities, operate in the same way. People would say, that's not a part like these others. That's more who I am. That's myself. So I came to call that self with a capital S. And now, almost 40 years later, thousands of clients later, we can safely say that that's self in its undamaged state is in everybody, just covered over by these parts and their burdens, such that when space is opened, it pops out and takes the lead. And that turns out to be the big deal about IFS, that discovery I just stumbled into. And then the last piece is, again, as a family therapist, I became very interested in this as a system and how these parts operated as in relationship to each other, and developed a map to the territory that is quite simple, but has held up really well over all this time. And that is that we all carry parts that other systems would call inner children, who are young and vulnerable and sensitive. And when they're not hurt, they're also the parts that we love the most because they're playful and they're creative and joyful, and they give us all these wonderful qualities. But once they get hurt, once they're burdened, they're the parts that get hurt the most. And they feel the emotional pain, or they feel the shame or terror the most. And after that, we don't want anything to do with them because they can take over and make us feel all that. And so not even knowing that we're locking away some of our most precious qualities, we think we're just moving away from memories, sensations, emotions, and beliefs that we don't want to be around. We turn them into inner exiles. And once you get a lot of exiles, the world becomes more dangerous, you become more delicate. So there's all these other parts have to jump into roles they're not designed for to protect the exiles and to keep them contained. And so some of them try to manage our lives so that the exiles never get triggered. So they're trying to control how close we get to people, control our appearance, control our performance, all in the effort to preempt anything that might trigger our exiles. Because when the exiles get triggered, it's like this explosion of emotion, flames of emotion that threaten to burn you alive. Mm-hmm. Now, the world still has a way of breaking through those defenses and triggering the exiles. So there's another set of parts that are forced into these roles of when that happens, after an exile gets triggered, getting you higher than the flames or distracting you till they burn themselves out, or somehow impulsively getting you away from the sensations. So we call them firefighters because they're trying to fight the fire of the exile's pain. And they do it in contrast to the managers I talked about earlier. They take you out of control. They're very impulsive, and they don't care about the collateral damage that you do to your body or to your relationships. They just know they've got to get you out somehow. So most symptom patterns in the DSM, I could give you this alternative explanation for in terms of which protectors are clustered to create that symptom.
As you were talking, I heard so many things that are very aligned with NARM. So I imagine Larry may have some things to share in response to how we view some of these pieces in NARM.
Great. Love to hear it.
Yeah. Well, and as I was listening to Dick, I was trying to see what the common ground is. Mm-hmm. Clearly, some of the languaging and the way we do it is a bit different, but I've also been around for over 40 years myself, and I also was trained in both structural and strategic family therapy. And so, but then I had a lot of psychodynamic work and somatic psychotherapy backgrounds of various kinds. So we bring some similarities and maybe some differences in our background, and then maybe too in terms of how we frame and understand things. But I don't talk about parts in the same way, but I do talk about how we, in growing up, we learn to foreclose significant aspects of ourselves. So you use the word exile. It wouldn't be my word, but that's basically what I'm saying is that we disconnect certain important elements of who we are from our consciousness. And generally then later, those parts, those foreclosed aspects of ourselves return in the form of various kinds of symptoms. So again, it seems similar in that sense. I also read a few things that either you wrote or some of your teachers or other people wrote. And you say something that I strongly resonated with, and I wanted to start with that, which is that I don't remember now where I read this, but you wrote something about there's a part of us that always remains undamaged. And that's a very non-Western orientation, and it's exactly my own as well. And I say that in a slightly different way. Yeah, I talk about the spontaneous movement, and all of us is towards healing, connection, and so on. And then the NARM work is exploring what gets in the way of that kind of integration. And it's part of setting up a clinical dynamic in NARM where we're not efforting so much, that we're more working with a certain kind of an awareness. And when we try and fix and when we try and move things around from a NARM perspective, we often are interrupting the process. So there's a very strong orientation in NARM towards a kind of our role as therapists is to support an organic kind of coming back to the source, coming back to deeper connection. The original title of my most recent book was Connection, Our Deepest Desire and Greatest Fear. And dealing with what I call in NARM the core conflict. And in the NARM work, we work a lot. It depends on what level we're working at any given time, but ultimately it's going back to this core conflict between what is most authentic and alive in us and the various kinds of learned dynamics that we have taken on that then get in the way. Now, I think similar to you, and I'll share this with you, you can see if you relate to it or not, but one of the things that I talk about, for example, is the so-called traditional defense mechanisms that we have used in psychotherapy. And even not sometimes we don't even talk about them as defense mechanisms, but as pathologies. So for example, I talk about dissociation, not as a pathology, at least initially. And I talk about it, and dissociation is that capacity which helps human beings bear the unbearable. But then we continue in these old patterns long after they're needed. And that's where they become what I don't use the word pathology in my work, and in that world, and I'm not interested in spending more time in that kind of traditional orientation, but that's where they become at least problematical, I would say, is that as we continue to use these patterns reflexively, then they get in our way. And then they create symptoms and difficulties and so on.
Yeah, I mean, that's pretty similar, like you said, in a different language. So that is the way I see most every pathological symptom, is some kind of often protective part of us that's, again, frozen in time, back during a time when it was really needed to do that job. Not knowing, like a lot of those parts, like you mentioned, dissociation. So if you were dissociating right now, I'd say, Larry, let me talk to that part that just took you out for a second. And while you're in it, you couldn't talk, or you couldn't, talk to it even. If I said, okay, so you're the part that took Larry out just now, is that right? And I get that something happened that scared you. So why did you jump in? Why did you just take Larry out? And I would get an answer. And it could say, you got too close to this particular emotion. And I'd say, oh, I'm sorry, we went too fast. So we're going to slow it down, and we'll touch base with you as we go. But would you mind now just stepping back so I can keep doing the work, and we'll make sure that we don't go too fast. And boom, the guy's not dissociated anymore. So if I were to ask that part how old it thinks you are, Larry, often you get a single digit. It thinks you're the age it jumped into this role when you were. So it might think you're 6 years old still. And it's shocked to learn that, I don't know how old you are, but that you're not 6 years old anymore. And relieved to learn that a lot of the time. So all that sounds quite similar.
Yeah, it does. I do this dynamic like around things that trigger us, for example, to what I call a deconstruction of experience. I work very much in the here and now, even though I'm psychodynamically informed and I work with personal history, of course. So for example, if somebody gets triggered and starts to go away, I'll back up the process and I'll begin to look at and slow the process down so that the individual can, from a different vantage point, again, outside being triggered, be able to reflect on what was going on previous to that moment where they went away. And then as we're able to deconstruct that piece, we see all the various kinds of emotional elements and the different identifications that surface. As that happens, there's a different dynamic that starts to happen, and people don't have the need to dissociate any longer. So,
yeah, I mean, again, that's quite similar, only I would do it directly by talking to the part, ask what happened just preceding it taking over. Yeah. And usually they'll be very clear about what happened.
Yeah, I find that too. When you're able to slow it down enough and then invite a different aspect of them to reflect on that, they're able to usually see pretty clearly what was going on.
Yeah.
The two parts I talk about a child consciousness and I talk about the embodied adult consciousness. And so much of where we are stuck, obviously, and the various kinds of survival mechanisms that we all use are artifacts of the child consciousness. And in various ways, I teach people how to support the development of the embodied adult consciousness. And the embodied piece for me is really important because there is a strong somatic element to NARM that I include in the work. And so that we all have had the experience of knowing something with our head, but not really knowing it like in ourselves and in our bones. And so that embodied piece is also a very important element of the NARM work.
Yeah, it is for us too. It wasn't initially. And then early on, I connected with a guy named Ron Kurtz, who developed Hakomi, and spent a lot of time teaching with him. And from that, they're very somatic based. And so I got much more interested in that side of it. And so what I was calling self, which maybe what you called embodied adult, might be the same, I'm not sure. What we find is that one of the impacts of trauma is that it organizes these parts to push self out of the body a lot of the time. Like I played college football at my size. You can't tell right now, but I'm quite small. So I ran into people full speed who were almost twice my size and as fast as me. So I came out of those experiences out of my body a lot of my life. And there were parts that in the face of anything would push me out, what I'm calling myself. And it took a lot of work to convince them it was safe to let me stay in my body. And when I'm in my body now, I can really tell the difference. And what I'm calling self is in the body. It has a lot more traction in terms of being able to comfort the parts, and they respect the leadership of the self a lot more. And a lot of the goal of IFS is what we call self-leadership, so that this essence of self is respected by the parts as a good internal and external leader. But you can't really do that unless you're in your body.
Yeah, I would agree with that. Yeah. I talk about the organizing self as well. So again, the kind of similarities here. I'm starting, as I looked over some of your work, I've had a number of students compare the two systems. So I was curious, and so I did some reading to kind of get a sense of who you are and what your work is like. And I did start to see that even though the languaging is different, that on some level we're looking at similar dynamics, maybe through a slightly different lens, but there's some common ground.
Yeah, it sounds that way. And I think people who decide to not go with all the dogma we've been taught and just listen to clients learn pretty similar things. And I think that's why it's so similar.
Yeah.
Well, it's funny. I have all these questions written out, and you both have just been answering the questions in the order. So there's some sort of like divine consciousness stepping in here. But another question that I had is, in NARM, we really focus heavily on the relational aspect of the therapist and the client. So I'm curious what role the therapeutic relationship plays in IFS.
Yeah, that's a really good question. And again, going back to the early days, I minimized the importance of the relationship because I think I was reacting to how central it was in more psychoanalytic or psychodynamic therapies. And mine was a bit of a pendulum swing away from that I saw it that was so excessive. And so I was very happy when I stumbled onto self, who seemed to be able to take the ball and run with it without much help from me. And then, and again, it was partly from hanging around with Hakomi folks, I started to get how important the relationship was. And again, this goes back 35 years probably, but important in a different way. So for so many psychodynamic therapies, especially attachment-based therapies, the therapist becomes the good parent figure, good attachment figure. And as a result, there's lots of transference and countertransference and big issues, and analyzing all of that is important. So this is what I call attachment theory taken inside. So rather than the therapist becoming the good attachment figure, what I call self becomes that for these young, desperate parts that create these different attachment patterns. And the one critique I have of attachment theory is that it doesn't really allow for that possibility. That I would say attachment theory basically says, unless you had a certain kind of parenting during a critical period in your childhood, you're out of luck until you get it from some external relationship. It has to come in from the outside. And I was finding people who had horrific, abused every day of their lives, tortured on a daily basis. There was no way they could have gotten any of this from their parents or anybody around them. And yet, when certain parts open space, there it was. It's basically the same self that people who had good childhoods had. And I couldn't account for that based on developmental psych. So I actually had to start looking more into spiritual. I wasn't spiritual at all. I come from this very scientific family. But students started to say, this sounds like Buddha nature, this sounds like Atman, this seems like the soul. And so I started to explore all that. And indeed, you do find correlates to what I call self in every tradition, described in very similar ways across tradition. And you don't have to meditate 20 years to get to it. You just have to get these parts to step out, and boom, there it is. And it doesn't have to develop, and it can't be damaged. So what I learned was the presence of the therapist and the therapist's ability to embody self is crucial. And it's crucial for a couple reasons. One is my presence when people sense it, because at least when I do therapy, I can pull a lot of self into my body. Clients' protective parts immediately sense the confidence and the safety. They immediately sense this guy seems very solid. So we can drop our guard a bit. And it also starts to resonate with the client self, like the tuning fork analogy, my vibrating self starts to do it with theirs and pulls it out. So self is kind of contagious that way. So the ability of the therapist to stay in that place and to notice your own parts as they get triggered and interfere and get them to step back in the moment so that you can stay steady that whole time is really crucial, especially as you're working with these highly, highly delicate traumatized systems that we do work with.
Mm-hmm. Larry?
Well, again, there's some common ground, even though maybe a little more psychodynamic and psychoanalytic, and certainly, I can't say I've really been influenced by attachment theory, but it grounded some of the things that I already implicitly understood and made some things a little bit more clear for me. I would also agree with you that to foster a transference relationship, as some psychodynamic therapists do, and then analyzing the transferences as it was understood, at least at some point, and I think is still by some practitioners, is not something that I would do in NARM. And I also resonate with what you said, that it's who the therapist is. It's the very, that kind of the level of integration that they've experienced has so much impact on the relationship. So it's in the field, the emotional and energetic field that we're in terms of the impact. But when, of course, transference is, from my perspective anyway, universal theme, when it comes up, we work with it, but it's just another projection that I don't want to minimize it, because of course it can be a very powerful process, but I don't want to foster it either. So that in NARM, when it comes up, we look at it and we bring in maybe in your language, the parts that have, let's say, a more here and now, more integrated perspective on it.
Yeah, you're right. It does come up. And so a client suddenly sees me either as this monster or as this savior. And for me, it's just a part. So I would say, okay, let's find the part that sees me this way. And let's see what that's about. And let's see where it's stuck in the past and so on. So.
Mm-hmm. And Larry, I'm curious if you wanted to comment on what Dick was saying about the spiritual aspects that were brought in.
As a person who's done a lot of spiritual work myself, it certainly has informed my orientation and is implicitly, and later in the trainings, more explicitly a part of what it is that I teach, because the orientation in NARM towards identity is really pretty much a non-Western perspective. That I have been influenced by object relations theory, for example, but there's never been, as far as I know and was exposed to anyway, in object relational work, an understanding of who is it that's holding all of these self and object images. And that's the basic question that comes up in NARM, is who is this person and that the self, to use our common term, is something beyond all of those self and object images. And when we are able to access those parts, we experience that with expansion, aliveness, flow, and various other kinds of energetic elements that are part of other traditions, more Eastern tradition.
So that's very similar to the way
it is similar.
Describe self. Uh-huh.
No, I was just going to say, in terms of, I never actually met Ron Kurtz, but I was the co-founder of the Gestalt Institute of Denver, and then a couple of years later, he founded the Hakomi Institute in Boulder. We had a lot of students in common, but I know all kinds of Hakomi people, and I read a couple of the books that he did, and I resonated that because we came from a similar, at least one of our traditions was similar, is that Alexander Lowen was his teacher. He was also my teacher. And so we drew from some similar sources. And I also appreciated his softening of these kind of harsh pathological, what was called at the time character structures that Lowen had developed. And so I appreciated that what he was trying to do. And he also brought in very clearly a spiritual perspective into his work. So again, a kind of another area of common ground here that we have.
Sounds like it.
Well, one last question I had. Dick, I listened to the interview that you did with Alanis Morissette and really enjoyed that. And you were talking about the 8 C's of IFS. And in just reading what those 8 C's were, I figured there's a lot of overlap with NARM. So could you talk about the 8 C's and their role in helping clients heal from complex trauma?
Yeah. So in the early days, as I was seeing this same self pop out in all these different clients, at some point, I started to catalog the qualities that would emerge spontaneously. And oddly enough, they all began with the letter C. So when I would have a client focus on a particular part and ask how they felt toward it, which is the way we start to access self, they would say they hated it. And I would ask them to get the one who hates it to step back. And then they're afraid of it, and get the one who fears it to step back. And then I would ask, now, how do you feel toward it? Clients would say some version, I'm just kind of curious about it. I just want to get to know it. I feel open to it. And so curiosity was obvious, and it's usually the foundational first one that comes up. And then in some cases, suddenly they would, even before curiosity, say, I feel sorry for it. I'm sorry this critic has to call me names all day. That can't be fun. So they would suddenly have compassion for it. And they would also be calm relative to how they felt seconds earlier. And they would have confidence relative to it. They weren't intimidated anymore. And they would also have the courage, not only to get to know this part, but to go to places in the inner world that they had been terrified of before. And they also had clarity. So the part initially looked like a monster. And then as all these other parts stepped back, it looked like a teenage kid. And they were much more creative in how they could relate to it. They weren't in the box anymore. And they felt connected to it in a way they hadn't before, and a desire to connect more to it. So those are the 8 C's, that, each of those words begins with the letter C, that have held up pretty well over all these years as the qualities of self that seem the most relevant to the healing process. There are a bunch of other qualities that we didn't include, partly because they didn't begin with the letter C, but also because these seem to be the most relevant to the healing process. So that's what the 8 C's are.
Great.
So I don't have a list of C's, but if I did, curiosity would be at the top of my list. And I talk about curiosity a lot in the NARM work. And I talk about it from the perspective of that one of the important elements of curiosity is that it assumes a not knowing. And so much of what, is like, at least from a NARM perspective, my perspective, is that we assume so much knowledge about ourselves, often negative, all these kinds of negative identifications that we develop. And that when we just start to become curious about these dynamics, it's an antidote to self-judgment, because self-judgment always implies a belief that you know what's right and what's wrong and that you're doing it wrong. And it activates different aspects of the nervous system, curiosity, as opposed to being angry or judgmental towards the self. It's a very different dynamic. When you're in this curious place, which I see as really a very powerful thing, instead of moving away from the world and away from yourself, you're moving towards the world and towards the inner world and the external world. So it's energetically and emotionally a very different dynamic. And so to support that and to develop that capacity of increasing curiosity is a healing process in itself. The other C's, I certainly could relate to those too. I talk about, for example, you mentioned confidence, because it is an uncertain world. There's a lot that we just don't know, that instead of being paralyzed by fear, the only antidote to all of the control that people try to use is confidence. A sense of being able to trust ourselves, to have this confidence that whatever it is, whatever challenges life throws us, that we'll be able to deal with it. And so as increasing confidence develops in individuals. I see that as, again, as the reflection of a core capacity that is essential for us as human beings to live in an uncertain world.
Yeah, again, I would agree. When you use the word develop, but then you use the reflection of a core capacity. So I'm more in line with the second phrase than the first. Develop implies it's not there and you've got to build it up like a muscle.
Not in the way I'm holding it, though. It's a core capacity that gets, in NARM language, gets covered over in our adaptations to early trauma.
That's right.
Misattunement and so on. And so in NARM, it's always an uncovering process because just like I say, it is a core capacity, but it gets clouded. It's like the murky water so that we're not in touch with it anymore. We get afraid and we're stuck in a fear response with it, which is a withdrawal response. And as we start to get in touch with this core capacity, develop is not exactly the word, but more uncover.
Yeah, that's all exactly the same. So
I guess our students were right.
Right.
They have been seeing similarities.
Yeah, because so many other both spiritual and psychological programs do see it as something you've got to build up, that it isn't inherent, and you have to do all these practices to get it. And like you, I find all you got to do is get these what I call parts that are in the way to trust that it's safe to let it out.
Wonderful. Well, I'm curious, actually, since the two of you have been talking about the similarities and differences in the models, do you have any questions for each other that have come up around this discussion?
I'm interested in, is there a particular type of problem that you learn the most from as you develop this, or that it's now being used for the most?
That's a good question.
This may or may not be an answer to your question. You can tell me if it is or if it isn't. But one of the things that I set out to do in NARM, which was to take the pathology out of the human condition, because so much of what I was taught was pathology oriented. So that was a really important element in my developing of this model, is that I don't see these dynamics as pathological, sometimes misguided or stuck in time, as you said, but not pathological. Now, behaviors can be pathological when you're hurting yourself or other people, but that's a different dynamic. But I'm just talking about these kinds of elements that we develop as a way of dealing with an environment that is less than supportive.
Mm-hmm.
Yeah.
So I don't know if did that answer your question, Dick? Did I move in the direction of what you were looking for?
It answered in the sense that you don't think about syndromes or the DSM, which I do agree. I mean, for me, those DSM categories are fairly accurate descriptions of the kinds of protectors that try to keep people safe. And I could take each one and give you a very non-pathologized description of the kinds of parts involved in each category. But in terms of how much, as you're saying, fear gets pumped into students by thinking about these syndromes in this pathologized way, we're on the same page with that.
Well, and again, my orientation to the DSM is, I think, relatively close to yours. I see it really just as from a NARM perspective, as a taxonomy of symptoms and strategies in NARM language. And so it can be a useful shorthand for clinicians sometimes if it's not carried too far, but it's not explanatory, and it's not really a tool to do anything with except to maybe communicate to other professionals in shorthand. But it doesn't explain anything. And so, so many therapies, and particularly, for example, CBT and others, are just so focused on extinguishing symptoms, which were once strategies of survival. Yeah. And it doesn't make sense that you want to extinguish. I mean, we want to eventually move beyond these symptoms and these strategies, but I certainly don't want to pathologize them or look at them as somehow defective because they saved our lives.
Yeah, that's right. Yeah, we're really on the same page with that. In IFS, mainly what we do in the beginning is go to the part that's creating the symptom and honor it for its service, like you might the military, and then ask what it protects and what it's afraid would happen if it didn't do this job, and then negotiate permission to go to what it protects so we can heal that. But in the meantime, asking the part, let's say we could heal that and you didn't need to do this anymore, what might you like to do instead? and you'll always get an answer. Often it's the opposite of the job they've been in, and it describes the naturally valuable state of the part. So yeah, we're really similar in that respect.
Yeah.
That if you go to these things with first openness, curiosity, but then ultimately as they tell you their secret history of how they got forced into these roles, they were heroes, and you just honor them. And then you learn about what they protect and heal that, and then they can shift.
My orientation too is to, it's not the word that I generally use, but I'm happy with the word honoring these kinds of strategies. And it makes it so much easier to move beyond them than to pathologize them or make them bad. It continues that process of foreclosing and distancing yourself. And so it takes us really in the wrong direction. So by welcoming them and understanding them and then bringing them back, as I say, back to the table or under the tent, what they needed to, they fulfilled their mission, to use that metaphor. And then it's much easier to move beyond them.
Right. And a lot of them, like, I come out of the eating disorder world initially, and virtually every treatment program in the country tries to defeat eating disorder, and puts the client against the eating disorder, and ed will kick your ass and will kill you, if you keep fighting with it. So what you find is that if you go to the anorexic part and just listen, it makes sense that it's fighting for its ability to, it thinks, save your life, because the next part on that hierarchy of what I call firefighters is suicide. And it knows if it didn't do this, then you would kill yourself. And so it's got to fight off all the therapists that are trying to get it to stop, because it knows you'll die if it doesn't. So, it's really closely aligned.
I'll mention like OCD, for example, where the exposure therapy is kind of like the go-to treatment, which from my perspective is the opposite direction of what we're, because there again, it's trying to extinguish these symptoms that are saving our lives, have saved our lives, without really understanding what it is that's driving that dynamic. And that's what I say to my students over and over again, is that we want to understand what's driving any particular kind of behavior or reaction, and not just get rid of it, because one, it doesn't work, and two, it's not very kind.
Yeah, I agree. Exposure therapy is torture for most people. The outcome studies reflect that, because the dropout rates are incredible.
Yeah.
And, in terms of that map I gave you earlier, one of the most important aspects of it is we've learned the hard way to go to these very vulnerable exiles only with permission of the protectors. So things like exposure therapy, and sometimes EMDR and some other systems, have the ability to bypass the protectors, bring forth the exiles that these protectors have been trying to contain for 30 years. And then there's this big backlash. The protectors attack the client, and the therapist thinks, oh, this person was sicker than I thought, and bring in all the medication and the hospitalizations, when if they were just more ecologically sensitive and asked for permission to go to these exiles, and went through all the fears the protectors have of going there, and addressed those fears, and then got permission, then you don't have any of the backlash. So I agree with you both about CBT, which is, it keeps you in your head more, and also about the processes that can bypass and get you to these very limbic places, but without permission.
Yeah, I agree. And even the name of the therapy, it's cognitive and it's behavioral, and it bypasses the emotional and the, not every CBT therapist does that, of course, but that seems to be part of this manualized process that it has become. That I read a quote that he's uncomfortable with the direction that CBT is taking, because he was once an analyst himself. And so, but yeah, again, it sounds like we're in agreement. But I do have a question for you.
Sure.
One of the things that I think NARM is really useful for is working with the earliest kinds of traumas before there's much of a psychology. So with prenatal, intergenerational trauma, very early attachment loss, and other kinds of profound difficulties that people can experience. My experience and the feedback that I've gotten from so many people is how powerful it is to be able to address these earliest kinds of trauma, before there were words, before there were images, And I'm just curious how you might address that in IFS.
Yeah, so a lot of times as we focus on what we call a trailhead. So a trailhead could be some thought or emotion that the client's interested in or is in their way. As we focus on that and we just stay with it, have the client stay with it, it'll take them to pre-verbal places. So we just have them stay with that, usually an exile, a part that they locked up somehow. And I used to think with those parts, we couldn't get any memory because, psychology says memory doesn't start until age 2. But it's amazing a lot of the time. I've had it where people would see aspects of their birth process that they didn't know about, and then they went and checked with their parents and was corroborated.
Wow.
But yeah, a lot of the work, get to a part and you get to a place where you want to heal it. We do what we call witnessing. So I would have you, Larry, ask this part to show you where it's stuck in the past, what happened to make it feel so bad. And suddenly you might see yourself as a 1-year-old, something like that. And you might not get the images, but amazingly, sometimes you do. But you would feel the sensations, and your body might move in ways that are telling the story, or allowing the part to feel like now you finally get what happened to me. And once a part feels witnessed, that's a big part of the healing. And then I would say to you, Larry, I'd like you to go into that scene and be with that little boy, that little infant, in the way he needed somebody at the time. And you would say, okay, I'm there with him. And what does he need you to do with him or for him back there before we take him out to a nice, comfortable place? So this is what we call the retrieval, part of the healing process. And then you would take him out to a good place. He would start to feel comfortable and safe, at which point this little infant would be willing to give up the burdens, the emotions and beliefs it got back there. There's a process, a little ritualized process for getting it out of your system, at which point he would feel great. He would feel like a little happy 1-year-old. And then we'd bring in all the protectors to see that they don't have to protect him anymore and they can take on new roles too. So I'm just giving you the process in a little nutshell.
Mm-hmm.
Mm-hmm.
To answer your question, yeah, we do work with pre-verbal parts, and that's the way we do it.
Okay.
Well, I'm just so very appreciative. I feel like I've learned so much just by sitting with the both of you, and I always appreciate being with and learning from the masters.
And it's great for me to find kindred spirits, and there aren't that many of us that think this way.
I agree, Dick. It is nice that from slightly different angles, I think we are looking at a lot of similar dynamics.
Great.
Wonderful. Thank you so much, both of you, for being here.
Yeah, thanks, Sarah.
Thank you for that. You did a good job.
Thanks so much for joining us for today's episode. If you want to learn more, you can check out the show notes or visit us at www.narmtraining.com/transformingtrauma. Please join us for our online NARM training in learning how to transform trauma. This online NARM basics training is available for professionals working with clients or populations dealing with complex trauma. Join us for this level 1 NARM training to become a NARM-informed professional. For more information and to apply, please visit at www.narmtraining.com/online-basics. Thanks to Andrea Klunder and the Creative Imposter Studios for producing and editing, to Tori Essex for our album art, and to Brad Kammer for the creation of this podcast. We really look forward to building community and connection with you and changing the world by transforming trauma.